Welcome back to N-Powerment Nursing. I am Ashley, one of your on-call professors of nursing. And if you're joining us on our Facebook page, welcome. If you're joining us on our YouTube channel, welcome. Regardless of where you come across this, we invite you to like and share this video to help those studying to pass their NCLEX, nclex-pn, or CPNRE exam. We're letting you in on a little secret today. We're going to talk about how the NCLEX, nclex-pn, CPNRE exam, whatever registration exam you're writing might be, how it is they test you on content. So listen up. We are full-time professors of nursing, so when it comes to writing test questions, we have some practice. We have some insight. We have some insider information we are going to share with you, which can really help you in your study process. So there's 5 main ways that you can be tested on nursing content. So basically the fundamentals that go into writing test questions, 5 main ways. The first of which should be obvious. Number 1, definitions. So you've probably noticed this as you've written exams throughout your nursing education. There's always definition questions. Like, do you simply know the definition of this? So while you're studying, really hone in and focus on different definitions. I always recommend to my students who are studying that they actually have a page for every test on the front of their study notes that is just definitions, because guaranteed 100%, those are those low-level questions. You're always going to have a certain percentage of just straight-up definition questions. The second type, or second way to fundamentally assess a nursing student or nursing graduate's knowledge base is through nursing principles. So do you remember that course you sat through in first year and you were like, this is common sense. Like, I don't really, okay, therapeutic communication, okay, the principles of this, the theoretical principles of that. Therapeutic communication is a really good example. Here's what happens though. You probably noticed that you learned about therapeutic communication in first year nursing, but that kept on coming back and was embedded throughout all of your tests. It's no different on the registration exam. Those fundamental nursing principles are usually what the difference is between those 2 correct answers that you get down to and you're like, oh, they both seem so right. Almost every single time, the right answer, because there always is one, comes down to one of those theoretical principles of nursing that should be embedded into your memory, such as the nurse never asked the patient why, because the registration exam and the nursing regulatory bodies think of that as why. So it's not like, oh, why do you feel that way? It's why do you feel that way? It's offensive. So that's just one example, okay? The third way nursing knowledge gets tested, priority. And this is massively huge on the registration exam. It's all over the registration exam because it's safety oriented and it tells us, do you know how to prioritize your time? Do you know how to prioritize care? Do you know how to prioritize one patient to the next patient, one action to the next action? In our program, we actually have an entire section on prioritization. So if this and this happens, this is what you do first. If you're asked this question, this is what you do first. Right? So do you know if a patient's O2 saturation is low, what you should do first? Should you sit them up or should you put oxygen on them? I'm not going to give you the answer, but if you're studying with us, you will know the answer to that question. So prioritization, what you do first. This is all over nursing education, and it is most definitely all over the registration exam. There are some things on the NCLEX exam specifically that kind of runs by its own rules. That is like on the NCLEX, this is the right answer. That's all spelled out for you throughout our program, which I suppose I should have had here to show you. 1 second. This book, it's all spelled out in this book. We also have CPNRE packages, nclex-pn packages, nclex bridging packages. we're in quarantine, so I'm doing this out my bedroom. So you know how it is. I'm not necessarily prepared. But prioritization. So can you prioritize if a patient has these symptoms and this prognosis and this pathophysiology, and this patient has this, which patient are you going to see first? So a lot of that knowledge comes down to content. If you don't know your content, you don't stand a chance. You might get lucky, but it's critical thinking related to knowing the content. Okay, number 4, top way to get tested on your knowledge. Can you recognize an emergency when presented with one? So do you or do you not know that if a patient is experiencing the symptoms of compartment syndrome, that is limb-threatening, life-threatening, you need to do XYZ right now? They're not going to tell you what's wrong with the patient. They're going to tell you the patient is displaying the following symptoms because they want to know if you can recognize that as an emergency. Another example of that might be the signs and symptoms of diabetic ketoacidosis. Can you recognize that fruity breath symbolizes a life-threatening emergency and you need to take immediate action? So that is a massively common way to assess a nurse's knowledge on the registration exam. And the final way that nurses are most likely to be tested, especially on the registration exam, is through differentiating concepts. And I can tell you with the utmost certainty, from creating thousands of test questions myself for my own students, this is probably one of the top ways that nursing educators assess your knowledge. Here's an example. Here's what I mean by differentiating concepts. So I teach pharmacology often, and if we're talking about, let's say, well, I'll give the example of if we're talking about blood pressure medication. So let's talk about Lasix. Everybody knows what Lasix does, furosemide, also known as furosemide, right? It gets water out of the body, but what also goes with Lasix is potassium. So a diuretic, right? Now, we're going to teach you a whole bunch of different types of diuretics. Lasix or furosemide is probably the most common one, but we're going to teach you 4 or 5 or 6 different types of diuretics. Almost every single person who ever graduated nursing and had to take pharmacology will know that we are always going to ask you which diuretic spares potassium. Why do we ask that? It's because it's the one thing that makes it different from the rest of the diuretic drugs, right? So aldactone, spironolactone, to me it sounds like a pterodactyl. That's just how it's in my brain from years ago when I studied it. So that question always comes up, right? Aldactone, spironolactone is the potassium-sparing diuretic. The potassium-sparing diuretic. So that is the thing that makes that medication different from the rest of the medications in its class. Got it? So taking similar things like placenta previa and placenta abrupto and knowing what makes those two things different will get you questions correct, because we test you on what makes them different, not what makes them the same, because it's way harder to test you on like, what do these things have in common? But we will test you on what makes them different, because you really have to know your content in order to be able to tell me what makes 2 similar things or 5 similar things different from one another. It shows that you critically know, and that is what the registration exam is assessing, is your critical knowledge. So whenever you are, I'll show you an example in our textbook. If I can just flip to one quickly here. That's not a good example to get my point across. I should have had all this ready, but I'm just thinking as I'm going. Okay, so this is why we use in our program tons of side-by-sides. So you can see here, this is a fluid replacement chart. We have isotonic in the middle, hypotonic, and hypertonic. Did you know you can actually just know 3 isotonic fluids and you can know all of the rest of the fluids and whether they are hypotonic or hypertonic? But when you study in side-by-sides, it pulls out the critical differences between these similar concepts, and then you have like a visual memory of it. It's absolutely incredible how it works. We hear this feedback from students all the time, like, I wish I would have studied like this my whole education. You make it so easy. I can't believe how much I can retain and remember. I don't have to think twice about the answer. So studying side by sides or tables like this pulls out what makes those similar concepts different, which is how test questions are written, which is why we use this approach in our program. So I'm so glad you joined me today, or whenever it is you come across this video. I hope these 5 most common ways nursing content is tested, especially on your registration exam, will really help you tailor your studying and focus in on the most important areas. And just to recap, those are: number 1, definitions; number 2, nursing principles, so those theoretical principles of nursing; number 3, what is a priority? You can't know that unless you know the content. Number 4, what constitutes an emergency? Like, when are you going to actually call the doctor, or when are you going to do something first? And number 5, differentiating things among similar concepts. So that's a little bit of insider information into how nursing educators and the regulatory bodies write your test questions. It is brilliant knowledge that we're sharing with you. We can tell you from experience in how we teach how students study, in their success, and us ourselves being full-time professors of nursing, we write test questions as a large component of our job. So we're letting you in on a little secret today. Thank you so much for joining me. I hope you found this video helpful. You can get more information at any time on our website, which is www.n-powermentnursing.com. On Facebook, we are N-Powerment nclex-pn test prep. And on YouTube, we are N-Powerment Nursing. On Instagram, we are @N-Powerment. We are all over the place. Thank you so much for joining me. I hope you found this video helpful. Stay strong in your study process. You got this. Bye.